Hello and welcome Applied Anatomy 1 and 2 students. My name is Dr. Bill Yessa, and I've created this introduction course video to get you acquainted with the course syllabus and some of the policies and procedures that govern this course. For those of you in Applied Anatomy 1, I wanted to welcome you and congratulate you on getting accepted into the program and starting your first term here with us. We're excited that you chose us and that you've chose this wonderful career and want to wish you luck on your academic journey. For those of you in Applied Anatomy 2, welcome back. Congratulations on getting through your first term. We're looking forward to working with you and continuing your knowledge in Applied Anatomy and continuing on in the course content. If you'll take a moment to please upload the course syllabus in your respective courses and follow along in this video, I will cover the major points and policies. However, please note that you are responsible for all of the information in the course syllabus as it applies to the course and helps you get acquainted with the policies and procedures and this course schedule and all of the details of the course content. On the first page of your syllabus, you'll see on each of your respective syllabuses the course faculty and the online faculty for each course. Please note that I do have some office hours that are available for you on the syllabus that's printed there. Please feel free to contact me during those times. Also, please be sure to contact any of your course faculty with your usa.edu email, as it is against school policy to respond to any other email other than the one that is assigned to you through USA. That is for academic reasons and for academic confidentiality purposes to make sure that we have secure communication with the student that is listed in the account. Further along in your course syllabus, you will find our course grading policies and procedures. I wanted to take special note of the special notes section that's in the box below. Students must pass all your practicals, so you must have a minimum passing competency of 80%, and you must be 100% safe with all of your practicals. If there are any issues that are experienced as far as reaching the 80% competency, or if you have what we call an auto fail, you'll be asked to retake. And in order to pass the course as a whole, you must make sure that you pass the lab components. The second bullet point is the final letter grade. All of your grade scores are weighted. Assignments and quizzes are worth 5% per. Your practicals are worth 20% for the first practical, 25% for the second practical. Your written midterm is worth 20%, and your final cumulative exam is worth 25%. So that is a weighted total grade. What the second bullet point says is once all the weighted scores are calculated, that gives you a final course grade, and that grade will be rounded to the nearest whole number. In the end of the course, if you have an 84.5%, that will be rounded up to an 85%, which would constitute a letter grade of a B+. However, if you have an 84.49, that is below the rounding up, so that will be rounded down to an 84%, and the final letter grade for that is a B. There are no exceptions to this policy. The final letter grade is the final grade that will be assigned to you in the course. There are no additional extra credit points or further considerations to bring that grade up to bring you up to that next letter grade. So please note that this is a university-wide policy, and the rounding up will be as stated in this special notes box. As previously stated on the last slide, this is the weighting of the course. Your final grade has different components. You have your written exams, which is a midterm and a final, 20 and 25% respectively. Practical 1 is 20%, practical 2 is 25%, and assignments and quizzes are 5% apiece. Further on in the syllabus, you will find some guidelines as far as turning in your online assignments. Please review this in its entirety as it gives you specific information. One of the things that we allow is the submission of up to, you can submit your document or assignment up to 2 times because sometimes students forget to include information. One of those things is proper citation and referencing. Please make sure that you follow the university guidelines as far as proper citations. If using our website such as the course Blackboard content or video presentations, you can cite Dr. Belyeso, myself, as the author for that resource. And please follow the proper way of citing a website or online content when putting that in your references section. We wanted to take a moment to talk about the practical retake policy as stated on the next several slides, but also please refer to the student handbook for more details on the retake policy. A retake is asked of a student in a couple of instances. For example, if a student does not receive enough points on the rubric to achieve 80% for that component. The second instance is if a student has what we call a critical safety item that is identified or an auto-fail item that is identified. Examples of this could be infection control issues, improper patient handling or safety, or not putting on a gate belt or locking a bed or wheelchair. All of these are examples of what we call critical safety or an auto-fail. If a student is asked to do a retake, we don't want students to think of this as a negative reflection or to cause increased anxiety for the student. Rather, a retake is a way of flagging particular areas so that the student is made more aware because of competency or safety, because we want to make sure that these things occur in your practice and that when you go into clinical rotations and working with patients, that you have these skills at a competence level and at a 100% safe level. The first retake procedures are a little less formal than the second retake. If you're asked to retake, which we call your first retake, you'll send an email to the course lead instructor that will describe the feedback that you received from your grader. The second thing to consider is describe how you'll prepare to be successful in your first retake. And the third thing is to reflect on what impact it may have on yourself as a therapist or on your patient for safety. You'll submit that email and your instructor will review it. If that remediation plan seems appropriate, the faculty will then schedule you for your first retake when that schedule is available. If you pass your first retake, then you will receive a maximum score of a 75% for that practical exam. For your second retake, the policy stated below in the next couple of slides is a little more formalized, and your course instructor will work with you to help you fill out formal documentation that needs to be filled out. You will also, once you work with your course instructor and they approve your documents, those will be sent to the APRC, which is the Academic Progression and Retention Committee. Dr. Joanne Laslovich is the chair of the APRC committee. They will review your formalized documents to make sure that your remediation plan seems sound and that you would be successful to move forward. The reason why this is a little more formalized is we want to make sure that you're working with your course instructor, your academic or your faculty advisor, and also if you need to work with the student services or student success services coordinator, these resources will be made available to make sure that you are successful in your second attempt. In your second retake, once you're approved by the APRC, you'll be scheduled to take that retake, and if you pass that, you will receive a maximum of 70% for the score for that practical. If you do not pass after a second retake, then you will receive either a D or an F grade, depending on how your final assessment is for the overall course. Receiving a D or an F will constitute a need to retake the course, and also will have modifications to your schedule in the following term. Another guideline or policy and procedure that we'd like to draw attention to is our professional behaviors. Professional behaviors are an important aspect of your development here in the program. We want students to start building those skill sets, those technical and non-technical skills that help shape who you are as a student and as a clinician. Professional behaviors can be how you interact with your fellow classmates, how you interact with your faculty, and the university staff and administration. Some of the identified areas of professional behaviors are included in the bullet points, but there are also things that go above and beyond what is stated here. Some examples are how you communicate via email or how you communicate face-to-face with your fellow students or faculty. Also, how you conduct yourself in class, your attendance, professional dress, professional behaviors, and adherence to any of the university policies and procedures. Students who are exhibiting difficulty with some of the professional behaviors, if there are behaviors that are significant, they can be referred to the Professional Misconduct Committee, which is the PMC. The Professional Misconduct Committee hears particular cases if they are referred to by faculty or staff or by students, and the Professional Misconduct Committee can make additional penalties against a student, such as requiring additional coursework, dropping of the final letter grade, or any other areas that can be recommended by the Professional Misconduct Committee. There can also be recommendations for suspension or dismissal from the program, depending on the severity of the professional misconduct. For PCCM1, this course, the late assignments or penalty for any quizzes or assignments is a 20% deduction. If that does not meet the deadline for the particular coursework, a 20% penalty will be assigned to anything submitted after the due date and time. On this slide and within your course syllabus, you'll note the sections of your mid-course warning and your withdrawal date. The mid-course warning is the date as indicated on your current course syllabus, and this serves as a way of communicating in the term and in all your courses. At the midterm of the course, you will get a communication of your current standing and your grade up to this point. Any students who are at a 70% or near a 70% or below the threshold will receive a communication from the course instructor or from the registrar to give a student a heads up of their current progress. What this allows is for the student to know if they're progressing well, if they're at risk for non-passage, and gives the opportunity for students to be made available to the academic advisor, your faculty advisor, your student success coordinator, and additional resources such as group tutoring or private tutoring to help you be successful in the course. The university wants to make sure that all students progress and are successful in moving forward from their course into the next term. And so the mid-course warning will be issued to allow the students to reflect on their grades and look at their current standing if they need additional services. The withdrawal date is as indicated in your current syllabus and the date that is posted there. The withdrawal date allows students to drop out of a course. If they do it before the withdrawal date, they will receive a W on their transcript. The W stands for withdraw, and that allows the student to retake the course in the following term. However, because of the retaking of the course, the student will have a modified schedule in order to accommodate that class, and will have a reduced schedule for the coming term. If a student does not withdraw and they continue in the course and receive a non-passing grade as a D or an F letter grade, the student will have additional academic penalties that are described in the faculty or in the student handbook. Please refer to the student handbook for the policies and procedures regarding receiving a non-passing grade. However, if the student receives a W, that does not carry the academic progression penalties that are equivalent for a non-passing grade, such as a D or an F grade. On the last pages of your course syllabus is the course schedule, and please be sure to follow this closely as it gives you a good pacing to get through all of your online content, and also is the schedule that'll be followed for all of your quizzes and assignments that are due. It also talks about when your lab weekends are and content that would be covered or is expected to be covered during that lab weekend. One of the things that you'll need to pay special attention to, and a lot of students get a little confused on the policy, and I'll go ahead and explain here is the special note. Please know that the BlackBoard is actually based on the time zone for Eastern Standard or Eastern Daylight Time, depending on the time of year. And that's because our main campuses, or our first campuses, were in St. Augustine in Florida, and as also a campus there in Miami. So we base our Blackboard on the Eastern or East Coast time zone. What that means for us here in California, being in the Pacific time zone, is if you submit your quiz or assignment that's due, say you submit it at 9:30, that's perfectly fine within the time zone expected time because you need to turn it in before midnight. However, Blackboard will actually timestamp it 12:30 a.m. since they are 3 hours ahead on the East Coast, and you'll actually see the word late next to your quiz or assignment. Please note that we will make the exceptions and calculate your submission based on Pacific Standard Time, even though the Blackboard said it was turned in late. In order to avoid any confusion, we ask you to turn your assignments in before midnight so that you don't see that late message or get confused. But please know that you will not have the 20% penalty that is assigned with that if you turn it in before midnight Pacific time. The last thing is, please note that the learning units are called week 1 and week 2, and so forth, all the way through on the left-hand panel. Please note that each week we actually go through a couple of weeks of content during the start of the course to kind of get through all the introductory information. So for week 1, you're actually going to do a couple of weeks to get that intro concepts down. So we don't go in week order. Everything is kind of compressed because of the course schedule. If you have any questions, please feel free to reach out to Dr. B to ask any questions about the special note or the order of units that we're covering. On the last pages, you'll see the course schedule and timeline for each of your weeks. Again, please note that you have on any given week, for week 1, we actually cover more than one module. So week 1, we're actually covering week 1 and week 2. And then for this is for the Applied Anatomy 1. And on week 2, you're covering week 3 and 4. If you're in Applied Anatomy 2, you'll see on week 1, we're covering week 1 and 2. And then on week 2, we're covering week 3. So please make sure you follow the schedule closely on your respective courses. And also, please note that if you have a lab weekend, you do not have any quizzes due during that lab weekend. So I've adjusted the schedule to make sure that nothing is due when you're traveling to and fro to the campus for your lab weekends. But that does mean that the following week, that quizzes will either be due on Monday or Sunday in order for us to get through all of those quizzes. If you have any questions, please feel free to reach out to me. And again, please follow the schedule very closely as it is planned out for each of your courses. Thank you so much. This concludes our introductory video for the course syllabus. If you have any questions, please feel free to reach out to Dr. B via email or through my office number. And we're looking forward to working with you throughout this term. Wishing you safe travels as you travel here on your assigned lab weekends, and you'll meet your lab faculty and start going through the content. We wish you much success in the term and success throughout the course, and looking forward to working with you. Once again, welcome to Applied Anatomy, and have a wonderful rest of the week.